and then we'll make a start to this webinar. Okay. While we are admitting persons to the webinar, I will just remind you that the webinar will be held in English and Spanish. There will be simultaneous translation. Translation is available usually at the bottom of your screen. You can click on the globe icon at the bottom of the screen. Sometimes you may have to click on the More button to find the globe. So we do have translation, interpretation available. Okay, as people are coming in, I'll just ask you, you may introduce yourself, as some people have started doing, you may introduce yourself in the chat.
Oh, Colombia, Peru,
Yes.
fantastic. Bolivia,
Okay.
well done.
All right, so I think
And
we can
welcome,
start
Lucy.
now. Most persons have already entered the room. I'd like to welcome you once again. My name is Audrey Morris. I am the PAHO advisor on food and nutrition, and I will be facilitating this webinar on digital safeguards protecting breastfeeding. And this is in honor of World Breastfeeding Protection Day, which is actually tomorrow on the 21st of May. Once again, I will remind you that there's interpretation available. You may click on the globe at the bottom of your screen to enable that. So I would first like to introduce Dr. Vanessa Garcia Larson, who is the Chief of the Risk Factors and Nutrition Unit in the Department of Non-Communicable Diseases and Mental Health of PAHO, and she will formally welcome you.
Thank you, Audrey. Hello, everyone. It's very nice to see how many different countries are joining us this morning. I'm absolutely delighted to welcome you all to this morning's discussion to explore the evolution of our region's most fundamental support system. Breastfeeding is more than a nutritional choice. It is our most resilient and sustainable food system. However, as we navigate 2026, we must acknowledge that the environment in which parents make decisions has fundamentally changed. We have moved from the physical clinic to a digital frontier. And to address today's challenges, we therefore must ground ourselves in our history. The International Code of Marketing of Breast Milk Substitutes, which was approved by the World Health Assembly in 1981, remains the cornerstone of infant health. It was created with a simple, vital purpose: to ensure that marketing does not override science and that commercial interests do not interfere with the parents' rights to objective health information. The code's impact is undeniable. In countries where it is strictly implemented, breastfeeding rates rise and infant health outcomes improve. Yet, in Latin America and the Caribbean, only 43% of infants are exclusively breastfed in the first 6 months of life, which is short of the 60% target to be achieved by 2030. The gap between where we are at the moment and where we need to be is often filled in by a digital environment of persuasion. With the 2024 World Health Assembly resolution as our guide, we recognize that the challenge has become more subtle. And as we steer this new era, we must address ways in which the traditional support system for parents has been transformed by technology. We see this first in algorithmic reach, where the digital tools meant to connect us can inadvertently prioritize promotional content at a time when parents are most seeking reassurance. And this is compounded by a shift in digital transparency. The line between genuine community support and sponsored influence has become increasingly thin. making it difficult for families to distinguish between peer advice and commercial promotion. And finally, we must champion data integrity. Our personal data should not be a means to identify and target individuals for commercial gain. Strengthening these areas is not just a technical necessity, it is how we preserve the trust and privacy that every new family deserves. In today's webinar, we will therefore address strategies and tools to ensure that the protected space envisioned in 1981 exists on a smartphone in 2026. To that end, today we are going to analyze how digital marketing circumvents national legislation. We are going to present tools to help member states monitor and document digital violations. We are going to inform countries on how to strengthen legal frameworks to ensure national laws cover social media and also artificial intelligence-driven promotions. Our experts today are going to provide the technical and legal clarity needed to modernize our approach. The International Code is a living document. It must be as agile as the technology it seeks to regulate. By prioritizing the health of our children over commercial metrics, we will therefore secure the well-being of future generations. So welcome once again, and thank you all for your dedication to this vital mission. Thank you.
Thank you so very much, Dr. Garcia Larson. And you have really very ably set the tone for this morning's webinar. We're going to move into our first presentation, and our presenter is Dr. Marina Rea, National Coordinator of the International Baby Food Action Network, IBFAN, and she's located in Brazil. We'd like to welcome you, and please go ahead with your presentation.
Hello, everyone. Voy a hablar español porque no hay traducción en portugués.
Good
A lo
morning.
mejor lo hablaría en
I'm going to
portugués, pero
talk in
vamos a hablar en
Spanish.
español.
I cannot talk
Y
in Portuguese.
hoy estamos
Today,
viendo hablar sobre los
we
desafíos
are
de
listening
la
about the
regulación de la
challenges in
comercialización
terms of
digital de fármacos
regulation and
infantiles
digital
comerciales y otros
training
productos que
and other
interfieren en la
products
lactancia
that
materna.
interfere in
Yo preguntaría si se puede
breastfeeding.
ampliar
I don't know if we
pantalla de mi
can
presentación.
expand
Me parece no
my
está en el
presentation.
formato
This is not in the
panorámico,
format.
no sé.
Sí, se ve muy bien. Nosotros vemos la pantalla.
Sí.
¿Sí?
Yes, we
Bueno,
can see it very well
creo que no
on
estoy
the
viendo
screen.
bien. Ok.
Maybe I am not seeing it very well. Well,
No tengo ningún conflicto de interés a declarar.
I don't have any conflict of interest to declare.
Celebrar el hecho de
And
que
first of all, I
mañana
would like to
pasamos
say that
45 años del
tomorrow
código.
we are
El código
making
que
45
Vanessa acaba de
years of the
mencionar,
code.
que es
The code, as it
haciendo
was already
nuestra herramienta de
mentioned,
trabajo por
is
tanto
our
tiempo,
working tool for so
45
long,
años,
45
y se
years,
agregó a él las resoluciones
that we are there
subsecuentes
to
que
it,
fueron
and
tratando de
the
actualizar tanto la
corresponding
publicidad como los
resolutions in
productos
terms
que
of
se
advertising
añadieron
and the
en esos
products
últimos
that
años
adhered to the code in
interferir
recent
en la lactancia
years
materna.
to interfere in
La lactancia
breastfeeding.
materna es
Well,
fundamental. Sabemos
breastfeeding
de eso,
is a challenge, it
desde el
is
nacimiento,
fundamental
4 años
from
o más,
the birth.
fundamental para la
We
salud y
know
crecimiento del
that
niño
it is
y
fundamental to
también
the
la salud
growth,
integral de la
health, and
infancia y en
comprehensive
consecuencia para
development
la
of
salud de la
children
vida
with
adulta
consequence
para la
for
mamá.
adult life
Pero
and
para
for
practicarla
mothers.
hay
But
desafíos.
to
Entre
practice
los principales
breastfeeding, we
desafíos que
face
enfrentamos hoy
challenges.
día,
Among the main challenges we face
encuéntrase la
currently,
publicidad
we
agresiva
find the aggressive
que
advertising.
salió, no sé qué pasó. La publicidad agresiva del marketing digital
Aggressive
está
advertising of digital
crecientemente
marketing that
presente
is growing
en los medios
in the social
descontrolados.
media with
¿Cómo
no control.
controlar
How
esta
are we going to
publicidad? Es
control this
nuestro desafío de
advertising?
hoy.
This is our current
Bien,
challenge.
siguiente, por favor. Estaba que yo que lo pasara, no. Ah, no sé qué pasó.
I don't know what happened to my presentation.
Nosotros vemos la siguiente slide, Marina. Se ve bien, dice cómo está la situación en América Latina y el
We can
Caribe.
see in your
Okay.
presentation what is the situation in Latin America and the
posición, ¿de
Caribbean.
acuerdo?
Okay, I'm going to
Bueno,
change the
el
position.
código y la resolución, como he
Well,
dicho,
the code and the
son igualmente
resolutions
importantes
are important
y de
tools, as I
importante,
said,
¿cómo estamos?
in our
El
region.
último
How
informe
is the
es del
situation in our region? The
2016 sobre el
latest
código que
report,
participamos y que fue junto
2026
con
report on the code,
OMS
where we
y
participated
UNICEF,
with
muestra que
WHO
solo
and UNICEF,
45% de
show
los
that
países de
only
América Latina y
45% of Latin
ha
American countries
adoptado alguna
have
medida
adopted
relacionada con
some
sus
measures
políticas.
related to its
Apenas dos
provisions.
países han
Only two
alcanzado una
countries have achieved a
alineación
substantial
sustancial
alignment.
y 36
And
países de
in
nuestra
16
región,
countries in
especialmente en
our
Caribe,
region,
no
mainly in the
existe
Caribbean, there
legislación
is
alguna
no
al respecto.
legislation whatsoever in this regard.
Puede pasar. Siguiente, por favor. De
Next,
este
please.
documento
And this
se
document,
muestran los países
we can see the
moderadamente alineados,
countries
los
that
sustancialmente
are
alineados, que en nuestra
moderately
región en este
aligned
momento es
with
solamente
the
Brasil y
code,
Argentina.
Brazil,
Algunas
Argentina,
son incluidas en el
some
código
included
están
in the
ahí en la
code
pantalla y
that
sin
are shown on the
disposiciones
screen,
legales.
and
Eso es
without
muy
legal
serio.
provisions, the
Son todos
countries
estos
without legal
países
provisions. This is very
especialmente
serious
de la
situation. All
región
these countries in the region,
caribeña, ¿no?
in the Caribbean region.
¿Puede pasar?
Next.
El siguiente, por favor. Bueno, ¿qué se puede esperar contra
What to
la
expect
regulación del
in terms
marketing
of
digital de
regulation of digital
sucedáneos de la leche
marketing
materna
of
en
breast
esta situación?
milk substitutes in
Incorporación de
this
la resolución
situation?
de la
Incorporate
Asamblea
the
Mundial 78
international laws,
18 de
Resolution
1925,
78.18
dice que
of
se amplíe el
2025
alcance del
states
código marketing
expands the
digital,
scope of the code
o
to
sea,
include
las
digital
redes sociales,
marketing, the
creadores de
social media,
contenido,
the content
influencers,
creators or
plataformas
influencers,
tecnológicas,
technology
etc.
platforms,
Exhorta
etc.
a cada Estado
It
miembro de la
urges each
OMS a establecer
WHO member
mecanismos
state to
regulatorios
establish
eficaces
mechanisms
y
that are
exhorta a aplicar la
effective
guía regulatoria. Esta guía
and
regulatoria que fue
also
el
urges to
motivo
apply the
principal que
regulatory
hicimos pasar la
measures, the
resolución, el
regulatory
Guidance on
guidance for
Regulatory
the
Measures
approval
aimed at
of the guide,
restricting
the
digital
guidance on
marketing of
regulatory
breast milk
measures aimed
substitutes.
at
Es
restricting digital
importante que
marketing
los
of
países
breast
tomen en
milk
cuenta
substitute. It is
eso.
important that
Los avances
countries take into
posibles
account
hoy
this.
para regular
The
este
possible
marketing digital
advances in
se
regulating digital
observa en la
marketing are
región, en
observed
Brasil,
in
en
the
Bolivia
region,
y en
in Brazil,
Honduras.
Bolivia,
En
and
Brasil, a través
Honduras. In
de nuestra
Brazil,
norma, de
through
nuestra ley
our
del
standard, our
2006,
law,
hay un dispositivo que dice
2026
que
law,
se
we have
puede, la
a
normativa se
mechanism
aplica a todos los
stating
medios de
that the regulation
comunicación,
is
lo
applied
que
to
abarca
all
publicidad
communication
digital
media
y
covering
medios sociales.
digital
No quiere decir
advertising and
que eso
social
está
media.
dado,
It
quiere
doesn't mean
decir
that it
que
is applied.
tenemos
It
un
means
principio
that we do have
trazado
a principle to
previamente.
work
Es un poco más
on.
complejo,
And the
uno de los más complejos de
situation,
la
the
región,
framework is
porque
one of the most
afirma
complex
que cualquier
frameworks
práctica
in the region
publicidad o
because it
comercial
says that any
está
form of
prohibida.
advertising is
Por tanto,
forbidden.
el Comité
It
Nacional
is
de Lactancia
important
Materna
to
podría
highlight the
hacer
Committee on Breastfeeding
un trabajo sobre
could do
esta
a work on
temática.
this
Y
topic.
Honduras
And
también incluye la
Honduras
transmisión
also
electrónica
includes the
entre las
electronic
prohibiciones de
transmission among
publicidad
the
de
advertising
productos
prohibitions for
designados.
designated
¿Puede
products.
pasar? Para todo eso es necesario convencer las autoridades.
To achieve all this, we
Para
need to convince
convencerlas, para
authorities.
nosotros es muy
And
claro
for
la importancia
us,
del
it is
monitoreo.
clear that we
Diferentes
do need
países de América Latina
monitoring
han
in
hecho
different
esto,
countries in Latin
clasificado
America
ese
and the
monitoreo
Caribbean. We
periódico
had
anual,
periodical
que incluye
monitoring,
las prácticas digitales de los últimos
including
años, que
digital
eso hace
advertising in
parte.
recent
Paraguay
years,
también,
Paraguay
Guatemala también.
also, and
Y en enero
Guatemala.
de
And in
2025
January
decidimos realizar un
2025, we
monitoreo rápido
decided to
de todos
have
los
a quick
países de América
monitoring
Latina
of all
donde
the Latin
tenemos
American countries
miembros
where
de
we
IBE.
have
Ese monitoreo fue
members.
un monitoreo íntegro
This is
de
a
10
monitoring
días sobre las
of 15
infracciones del
days
código y leyes
on
nacionales.
the
Enfocamos
breaches
solamente en
of
productos
the national
alimentarios de
code, and
0
we
a
were
12
focusing only
meses
on
y
food
biberones de
items
tequinas,
for
como veremos a
0 and
seguir.
2 months
Este documento
babies.
se
This
hizo
document was translated into a report that we took to the Executive Council and then to the World Assembly in 2025, and it was really useful for the discussion with the countries that were participating then to support and approve the solution on digital marketing next. In the monitoring, we had the participation of the countries shown on the screen. Unfortunately, from the Caribbean, only Trinidad and Tobago, but many other countries participated. We had this methodology with computers and mobile devices. We were looking for online violations in the following product categories: commercial infant formulas for babies up to 6 months old, commercial infant formulas for babies from 6 months to 1 year old, formulas for babies with special needs, follow-up foods, baby bottles, pacifiers, and teats. When we found a violation, a screenshot was taken for verification and recorded in a Google form developed in Brazilian 4 languages, in Portuguese, Spanish, English, and French. The partial results I'm showing here, and that are also contained in the report, show some breaches by companies as Nestlé and Johnson and the other firms as Enfago, Natural Response, and Aftamine. Some violations, most violations were in social media, 56%, websites 27%, educational materials, unsolicited messages 9.4%, and other forms of online marketing and advertising, such as apps and targeted advertising, accounted for 6% of registration. We are going to see also some violations by countries for you to have an idea. In Argentina, there was a promotion, the advertising of pacifiers on the website. In Brazil, we had the promotion of infant formula for babies from 6 to 12 months online. In Chile, the promotion of infant formula for babies from 3 to 6 months old on TikTok. Also here, others in Colombia, this false or misleading claim. In Costa Rica, also, all mothers, they want their children to go further. In Ecuador, also in Instagram, we had infamy with the idealization of the use of the formulas. In Salvador, the idealization of the use of formulas also containing protein. In Honduras, also your baby, the milk is not working for your baby, you need to consider the appropriate use of milk. In Guatemala, discount on baby bottles. In Mexico, discount on formulas, on store advertising on Instagram. And Nicaragua also paid food advertising by a pediatric health professional, a supplementary food item by this professional with her recommendation. In Panama, the idealization of the use of formula and offering a free gift in a supermarket advertisement in Facebook. Discount on baby bottles in Paraguay in a store. In Peru, discount on baby bottles also with this company on Instagram. Puerto Rico, the idealization of the use of formulas in a post by the manufacturer on Instagram. Here, I just interested to see the WIC certification. It is certified by the WIC program. and Dominican Republic, the Similac, a formula of promotion on the website. And in Trinidad and Tobago, in the Caribbean, the realization of bottle use, the baby controls the pace. And finally, in Uruguay, discount on formulas. And here in Venezuela, also the idealization of the use of formula in an Instagram post. This is goat milk. Well, this situation took us to the conclusion that we do have these violations in other countries, in Latin American countries. And now we wanted to show the policymakers that we needed to have a revolution in the World Assembly. And we took all these violations and we concluded that we needed to update the definitions on promotion and advertising to explicitly include digital environments, technology, platforms, sponsored content, influencer participation, and other emerging forms of marketing according to recent resolutions. The guide is also bringing important resolution suggestions to be incorporated in the countries. We need to adapt the guidance according to the recommendations for restricting digital marketing of breastfeed substitutes to national legislation. And finally, report to AMS as proposed by WHO. Thank you.
Thank you so much, Dr. Marina Ray from IPFAN, for that very comprehensive report on the code violations that are seen in the countries of the region. We note the release of the very latest code report, 2026, which is very hot off the press, and that shows the status of code implementation and monitoring. So we're very grateful to you for that presentation. I'll ask participants to hold your questions, please, or rather place them in the Q&A usually at the bottom of your screen, and then we'll move to the next presentation, but we'll have some time for Q&A later. Over to you now, Dr. Monica Mazariegos from the Institute of Nutrition and of Central America and Panama, INCAP. And we welcome you for your presentation on regulation of the digital marketing of commercial infant formulas and complementary feeding products in Central America and the Caribbean. Please go ahead.
Muchas gracias por el espacio. Les saludo desde Ciudad de Guatemala.
Thank
Voy a
you.
compartir con ustedes resultados de
Thank you. I'm talking from Guatemala. I'm going to share the study on digital marketing of commercial infant formulas and complementary feeding recommendations for its regulation in Central America and the Caribbean. Well, I have no conflict of interest to declare. In recent years, the promotion and advertising of commercial infant formulas has evolved, and these products are a threat to the breastfeeding and to the food of citizens. That's why the international code was approved. However, many countries have adopted many of the resolutions. The digital environment is still a challenge to be addressed. The WHO recently showed with evidence that the digital strategies allow companies to target mothers, fathers, and caregivers with high frequency, and especially with with tailored advertising. In many countries, more than 80% of advertising is made through digital media. And it shows that digital marketing has been associated with the purchase and use of these products. In the region, in Central America, we have found that most regulatory frameworks are not up to date to address these challenges. And children from usually are not complying with the adequate nutrition. In the region, as I said, most regulatory frameworks are not up to date to address these challenges. Our objective is to generate evidence that strengthens the protection of the rights of childhood and consumers in the digital area. That's why our objectives include to characterize the landscape of digital marketing for commercial infant formulas in the region and identify the main strategies to promote these products, to assess the degree of non-compliance with the code and the national legislation based on the code, with the aim to strengthen the argument for updating regulatory frameworks and implementing effective mechanisms in the country. I'm going to show the digital ecosystem of these products. To understand the landscape, we had to do an exercise of exploring the legal status of the code in the region. We had this analysis in the country, in Guatemala, Dominican Republic, and Panama. I would like to mention that this analysis was made before the law was passed by in Panama. We found out that Guatemala and Dominican Republic are aligned and with the code. However, many of the resolutions that were adopted showed a gap or common gaps, legal gaps in the legislations in the countries, and these are related to the resolutions that were approved after the code. I am not going to show all the countries, but we had the analysis in the region and we found that even with different provisions, we had many gaps in the areas, in the different areas, and the main legal gaps are related to the lack of adoption and also all the products were not covered, and the last provision was not adopted related to the regulation of digital marketing. We were also able to identify the leading companies and the brands that are being promoted in the region, in the Central America and the Caribbean region. We found 13 leading companies and 17 monitored brands. We had the monitoring study covering the publications in different social media during 6 months in 2023 and 2024. And we found out 505 publications in digital media. We need to mention that the product that is usually trade are the growth formula, the formulas that are targeting children older than 1 year old, and they usually use Facebook. And they also focus in continuing breastfeeding. I would like to mention here, and I would like to keep in mind this information along the presentation, the products that are more that are usually trade were not clarified in the law from 12 to 36 months for babies from 12 to 36 months, and they are covered up to 12 months. We also had once we identified the main companies, digital marketing strategies used by companies. We were able to have a synthesis of the main marketing strategies that were used to promote these products, and we explain 8 types of strategies. And here you are going to see the bars. They represent the percentage of use for commercial formulas and also for complementary feeding.
The most popular strategies used are those that we call advertising messages. These are strategies that respond to pain points of the parents, and they use messages that promote emotional connection and that also use attributions. And the other strategies are those of optimization. Here we have to say that these kinds of strategies are used specifically in the digital media. And here I would like to mention that we use transporter accounts, and advertising is directed or is aimed at more than one country. For example, accounts that unite all of Central America and the Caribbean. So we see a lot of transporter marketing and also the use of strategies with optimization in specific hours to maximize reach. The other type of strategy is the segmentation of a targeted audience. Many strategies go to targeted audiences like mothers, fathers, or caretakers, and there is also advertising for health professionals. Another important thing are the visual formats that are used. We use carousel. They use carousels, reels, videos, hashtags, polls, survey polls, and specific buttons to get in touch with the brands. The other strategies are according to the type of publications. Here we find tutorials, testimonies of parents that have used these kinds of formulas and that recommend them. So it's peer advices. We also see advices regarding the product and advice regarding complementary food. Finally, the strategies that we group that promote engagement. Here we have all of these strategies that use promotions, cross promotions, and finally, validation strategies that use influencers or brand ambassadors, and also health professionals, especially pediatricians and nutrition experts. We had identified all of these strategies, and we assess how these comply with the code and if they constituted infractions regarding the legislation based on the code in Guatemala, Panama, and the Dominican Republic. And here I would like to show this table with the non-compliances with the code regarding formulas, formula advertising. We found around 3,000 non-compliances regarding the code, and 73% of these non-compliances were constituted non-compliances regarding labeling. So here we had omissions of recommended tests, a use of text or prohibited images, and then the other omissions happen in other categories, such as informative materials, direct promotion to the public, and those that have to do with omissions to the code. This other table shows the main non-compliances regarding the code, And here we see that the main, more than 50% of non-compliances to the code happen in resolutions after the code, especially using professional endorsements and also declarations such as the importance of continuing with breastfeeding after 2 years of age. In each publicity post or advertising post, we found 3 advertising strategies and 7 non-compliances to the code. We don't have much time, so we're not going to go into detail, but here in yellow you have the marketing strategies, and in green you'll see why these are non-compliances regarding the code. But these kinds of formats allow to use different strategies simultaneously in a same publicity post, and especially using buttons that allow us to get in contact to provide advice or to direct you to sales points. Something that we would also like to mention is that we had access to what the mothers are seeing in their cell phones. We saw that when they are mothers, the marketing becomes even more aggressive, and engagement strategies increase in 5%. For example, they ask mothers what the baby is due so that they can follow up on life cycle, and also their invitations to join mothers clubs. After we review non-compliances regarding the code, we also wanted to see what are the infractions regarding the legislations in advertising. And something that we found and that's very interesting is that there is a higher level of infractions in the countries where the legislation is stronger. We find that there are more infractions in Panama and the Dominican Republic, and there are less in Guatemala, in which the legislation is lighter. And here you can see in red the aspects that are not regulated. And so anything that happens here does not constitute an infraction regarding the law. This is for child formulas. And here we can see a table regarding complementary feeding. Here you can see that although some countries have adapted some dispositions, the aspects that I mentioned before and with the subsequent resolutions to the code, these are not regulated and they do not constitute infractions. They are non-compliances regarding the code, but they are not infractions of the national legislation. And so this is what we call for strengthening the laws so that we can regulate all kinds of strategies used to promote these products. On the left-hand side, we can see compliances to the code, and on the right-hand side, for commercial products for complementary feeding. And the gap regarding the code is much higher. And you compare it to Guatemala, in both cases, the legislation has not adapted all of the code dispositions. The message is that the legislation is more robust and it reduces permissivity in the industry and to protect breastfeeding. And although we see that the laws right now are not perfect, they do capture infractions. And so laws should be applied more rigorously to protect breastfeeding.
y los productos dirigidos a niños pequeños están socavando los esfuerzos para el adecuado establecimiento de la lactancia y
Advertising
prácticas de
is
alimentación adecuada en niños pequeños.
reducing the
Ya
efforts
vimos que las
for
estrategias de
appropriate breastfeeding
marketing sobre
efforts.
todo están
So
enfocadas en
we see that
habilidades de
marketing
conversión,
strategies try to
acompañamiento
create
y
this
lealtad y están
um,
transformando el sistema
connection
alimentario temprano
and
porque
loyalty, and
están
they're
ultraprocesando el
transforming
diario de los
the
lactantes y de los niños
early
pequeños.
feeding system, and they are
El
transforming the
entorno
diets
digital,
of
como hemos visto,
breastfed
se ha convertido en
babies
un
as well as
componente
small
importante
children.
del entorno alimentario
Digital
y es
environment
importante que lo
has become
entendamos
an important
para proteger la
component
lactancia, promover
for
dietas
the
saludables en los
food
primeros ciclos
environment,
de vida y
and
fortalecer
understanding
las
its
políticas de
influence is key
abastecimiento
to
público.
protect breastfeeding, promote healthy
Quiero
diets,
terminar
and
compartiendo las
strengthen
recomendaciones
public
que se han
policies.
derivado de nuestro estudio.
I want to
Uno,
share the
hacemos un llamado
recommendations that come from
importante a
our study.
actualizar y
We
fortalecer las
call
legislaciones
for
nacionales para regular el
strengthening
marketing
national
digital y otras
legislations
formas de promoción en
to
todos los
counter
canales
digital
y
marketing and
entornos y
other
todos los tipos de
promotional
publicidad, no solo
forms in
digital.
all kinds of
Es
environments and
importante
platforms,
que
not
a
only
partir del
digitally.
compromiso que se
It is
asumió en varios
important
países
that
del sistema de integración
after the
centroamericana al
commitment
respaldar la
assumed
última
by several
resolución aprobada en
countries
la Asamblea
to
pasada,
back
pues
the
necesitamos avanzar en la
resolution,
actualización de
we
estos
need to
marcos
move forward in
normativos y sobre todo
updating these regulatory
incluir
frameworks
las
and
recomendaciones de la guía de la
including the
OMS para regular
recommendations of
el marketing
WHO to
digital
regulate
y
digital
buscar sobre
marketing
todo también coherencia
and
con
seek
otras
coherence
leyes. Ya
with
hablaban al inicio sobre la
other laws.
importancia de incluso
At the beginning,
proteger
we
los
talked
datos y
about
la
the
privacidad.
importance of protecting data and
Como vimos
privacy.
antes, es importante
As we
que
said
se actualicen
before,
las normativas,
while
reforzar el
regulations
cumplimiento
are
de las leyes porque funcionan,
updated,
¿verdad? Y
we have
deberían de
to
aplicarse
strengthen
con
law
mayor
enforcement.
vigor.
Laws should be
Desarrollar sistemas de
enforced more
vigilancia digital
vigorously. We should
especializados.
also
Tenemos el
develop
ejemplo de
specialized digital
Vigilancia,
surveillance systems
Observa
like
Más en Argentina y Código
Observa
Lactancia
Más
en
in
México,
Argentina
donde están
and Código
utilizando
Lactancia in
inteligencia
Mexico.
artificial
Here
para
they're using
monitorear el
artificial
correcto
intelligence to
contenido de
monitor in real
publicidad.
time.
Y por último, algo muy importante
Uh,
es fortalecer la cooperación regional.
and
Como
another
les
thing,
mencioné
it
antes,
is
hicimos un
important to strengthen
enfoque del
institutional
marketing
capacities.
transfronterizo y esto ha llamado y muestra por qué
We
es
have seen
importante que
transporter marketing,
establezcamos
and
una
this
serie
shows
de
why it is
mecanismos de
important
cooperación
to
regional que nos permitan
establish
enfrentar estos
regional
desafíos de
mechanisms
marketing que van más allá de un país y que se evite la fragmentación
because
normativa.
these
Esto
strategies
lo
go beyond
podríamos
one
lograr a
country, and
través
we
de
should avoid
armonización
regulatory
normativa entre países,
fragmentation, and we
vigilancia
should
digital
have
compartida
harmonization
o
between
tener
countries
también
and
acuerdos
shared digital
interinstitucionales.
surveillance,
Me
and
quedo
also
aquí
have
porque el
interinstitutional
asesor legal
agreements.
pues, nos va a
I
compartir más
will leave it
adelante
here because the
cómo se
legal
puede
advisor
aplicar todo
is
esto,
going
pero
to
son
share
recomendaciones y la
about
evidencia que
this,
generamos en
and
nuestro estudio respalda la
the recommendations
implementación
that
de
we
este
provide in
tipo
our
de
study
medidas en la región.
backs the
Así que
implementation
les
of these kinds
agradezco
of
mucho por el
measures in the
espacio
region.
y
So I
quedo
thank you
pendiente
for
para
the
cualquier
space,
duda.
and I
Gracias.
am at your disposal for any questions. Thank you.
Thank you so much, Monica, for that presentation on the regulation of the digital marketing in Central America and the Caribbean. It was very instructive that you noticed that you mentioned in your presentation that there's a great deal of infractions, even when there is legislation. And so it is timely that we have the next presentation from Dr. Ignacio Ibarra, Regional Advisor on Health-Related Law at PAHO.
Thank you very much, Audrey. Voy a hablar en español, si me lo permiten. Entonces compartiré mi
I'm going to
presentación.
speak in Spanish if you allow
Creo
me to
que
do
es
so.
importante.
Ignacio, may I just ask, there is a comment that Spanish speakers tend to speak a little quickly and the translation, doesn't follow as well. So maybe if you can keep it a little bit slower. Thank you.
Yeah, absolutely. Time constraint always make us speak very quickly. Voy a hablar lo más despacio posible. A veces es un cúmulo de información.
Yes, I'm going to try to speak as slowly as
Queremos
possible.
compartir con ustedes.
We want to share a collection of information with you,
Yo creo que
and
también tengo que
I
decir
believe I
todas
also
las
have to
grandes
say that
presentadoras que me han
the
antecedido
great
han explicado
presenters,
muy
speakers that
bien
came before
cuál es
me,
el
have
contexto
explained very
jurídico que
well
estamos
what is the
viviendo
legal context that we are
América, ¿no? De alguna
living
manera,
in America or in the
me han
Americas.
quitado el espacio de oportunidad de comentarles cosas interesantes.
They
No es cierto.
and I don't have much space to comment on interesting things because many things have been said. The code is going to turn 45, and we think from the legislation strengthening departments and areas at Tahoe that there are still many, many, many opportunity areas. And we must not forget that the international code has several objectives or goals that are very concrete. Promoting healthy food or feeding for minors, because we know that if during the first 1,000 days they don't have a healthy feeding, that is going to affect the rest of their lives. They are not going to have an appropriate mental or cerebral development. They are going to have future health problems in the future. Sorry, they're going to have health problems in the future. And protecting breastfeeding is guaranteeing equity and the way in which we ensure that all minors have the same start so that they are as the others or better instead of undermining them. So this is not only a decision that belongs to the parents, because sometimes we don't have enough information, and the obesogenic environment in which we live is affecting breastfeeding. Breastfeeding should be the only source of food in the first 6 months and possibly until 1 year. The third objective of the code is regulating the quality of products. And the fourth objective is everything that is associated with the information and advertising. Legislation today should guarantee the existence of these four elements.
En suma, lo que el código
In a nutshell,
internacional
what
hace
the
es
international
regular
code
o
does is that it
fortalecer o
regulates or
mandatar a los
strengthens
países que
or
aprobaron en
mandates
la Asamblea Mundial de la Salud del
to the
Código en
countries that
1988
approved
que
the code,
escriban en su legislación nacional en
the fact that they write in their
conductas
national legislation
obligatorias
that they
que
incorporate or
regulen la
include regulatory
comercialización y las
measures
prácticas
that can regulate
vinculadas con los
trading
océanos de la leche.
practices related
Los
to
océanos de la leche
formulas.
no son buenos.
Formulas are
Estamos
not
pensando en
good.
una visión de la salud
If we're
pública,
thinking about
salvo que
public
haya una
health,
justificación médica,
unless
clínica,
there's
no necesariamente una decisión
medical,
individual de los
clinical
padres, porque también hay un interés
reason
subyacente
and
de
not
los niños
necessarily
a tener
the
todo el
decision of the
potencial.
parents,
Y
because it
muchas
is
veces
important
los
for the
padres no están
children to
preparados
reach
para
their
esos
full
objetivos.
potential. And
¿Cómo
sometimes the parents are not
implementar entonces el
prepared
código
for
desde el
those
punto de vista
objectives.
jurídico? Ahorita ya explicaron muy
How
ampliamente
to
las
implement the
dos
code from a
expertas
legal point of view.
presentadoras que me
The two
antecedieron.
presenting experts
¿Cómo se ve
explain
en la
this.
realidad práctica, ¿no?
How do we
Entonces,
see
es
this in practical
importante ver
reality?
que
It is important to
se
see
necesitan
that
desarrollar
we
legislación,
need
marco
to
legal,
develop
marco regulatorio,
legislation,
que pueden
legislations,
ser
legal
implementados de
frameworks, like
diferentes
regulatory
maneras.
frameworks that can be
Puede
implemented in
incorporarse en
different
corpos
ways.
legales amplios, como en códigos de la infancia, en
We
leyes de
can
salud y en otro tipo de
incorporate
instrumentos, como ven,
laws for
no hay una
children, health
armonía
instruments.
en el lugar en
Sometimes
donde
there
se
is no
coloca la
harmony
legislación asociada
in
a la lactancia
places in
materna,
which
a la
we
promoción de la
put
lactancia
legislation
materna, a la regulación
associated
de la
to
comercialización. Y esto hace difícil
trade
también poder
regulation
determinar
or
quién es la
breastfeeding
autoridad
promotion. And so
competente
it
en
is
su caso.
sometimes
Me
difficult to
parece
determine
que
who
ahí
are the
hay también
competent
un área de
authorities.
oportunidad
And
que
I
es
also believe that
sumamente
here we have an opportunity
necesario
area that is
abordar.
very important
Incluso es
we
un tema de
must
promoción de la
tackle.
equidad, como decía,
And it
porque
is
deberíamos de
also
fomentar
a
que
matter
los
of
niños
promoting
que
equity,
tienen ese
because we should
interés privilegiado de
make sure
protección
that
que las convenciones
the
internacionales les
children that
mandan a los países también,
are
necesitan tener
have
esa protección
protected
extra, esa protección
privilege,
adicional,
we need to
y
make sure that
necesita
children
garantizar
that need,
también
need to
que
get
no habrá
protection do
mortalidad
get it.
materna
And we
ni
need to guarantee
perinatal,
that there is no
porque
maternal mortality
no
or
solo
perinatal
es el desarrollo
mortality,
futuro, sino
because
que
it's not
también son
only
causas de
future development,
fallecimientos
it's
tempranos.
also due to causes of
El
early
código, sus
death.
ajustes,
The
sus
code, its adjustments,
revisiones
its additions or contributions require that the mother has frequent consultations before birth and also have supplements to her diet. It's not automatic. If a mother is not well fed, she will have problems to breastfeed. And so, among the rights of the child, we have the fact of having mothers that have sufficient nutrition food so that and we also have to protect her during pregnancy. She needs to have protection, medical consultations during pregnancy, a protected birth, and then postpartum care. And sometimes the public sector also provides the opportunity to go to Congress from a certain company. And we believe that these are practices that should be completely eradicated. And it is fundamental to harmonize all of the legal aspects that are related to this. We have also said, and this is something that we agree with from our department, that there should be good advocacy to implement the code. It is a collective work between the government, public health institutions, academic institutions, civil society, and we can see how everyone can have a good vision. And what is the vision of the authorities? What are the authorities doing to making more robust their surveillance regarding regulatory frameworks? Because there are countries that have not implemented the slides that Professor Ferreira showed us. Only 2 countries are complying, and most don't do this. So we have an implementation problem. Implementing is bringing international obligations of the code to the national mandates, to the national obligations that are written in the legislation. And the second commitment is to make that this is complied with. This means verifying with through efficient media that these legal aspects are complied with. I'm not going to talk about my country because I'm an international official, but there are specialized legislation on regulating advertising, and there were instances authorized to monitor perfectly everything that was happening in advertising. But throughout time, the organizational structure disappeared, and today this regulation is dead. So it looks like we have to stop along the road. It is important to continue moving forward in the programs that are associated to breastfeeding, but complying with the code is a strictly legal matter, a strictly regulatory matter. So we need to strengthen the authorities' capacity to surveil the regulatory framework and its application. Let's not forget that this is about public health. In general, the measurement is very deficient in the Americas, and the capacities that the states have to protect and promote actively right to health is weak. So we have to promote compliance. We have to do strong parliamentary work. This is done along with UNICEF, with the FAO. We systematically meet with health commissions in all national congresses, but we are not getting there yet. I believe that these commercial factors is winning the game. To speak a little bit more about the complexity that this means, I would like to show you very briefly how people today use the internet, use digital media for our daily lives. This graph shows that in the United States, 80% of the people use the internet mainly for health topics. They seek information on their health. In Europe, 1 out of 2 Europeans seek
Esto es
health
aquella
information on the
información que
internet.
activamente buscan
This
las
means
personas.
this is the information
Esta es una
actively sought
gráfica
by the
de la
people.
Organización Panamericana de la
This is
Salud
a
al
graph
cierre del
from
2019 con datos
PAHO
de 2017,
from
en donde podemos ver
2019
que arriba del
and with data from
70% de todas las
2017,
personas están
and 70%
utilizando
of
el
people
Internet
seek the
para cuestiones
internet
vinculadas con
or
salud. Lo
use the
más
internet
interesante
for
es que
matters related
la
to
línea
health.
azul, que es la más alta,
And the blue
es
line, which is
Norteamérica.
the highest
Entonces,
one,
de
is
alguna
North
manera,
America.
bueno,
And
nos
so
hace ver que estamos en un gran
this
reto.
makes us see that we are
Ustedes saben que
facing a
todo se
great
busca en
challenge.
la Internet
You know that
y estos son
everything is
algunos
sought
datos
for on the internet,
estadísticos.
and this
Este
is
estudio, que es
statistical data.
de
This
2020,
study
nos
from
muestra cuál es el tipo
2020
de vocablos que se
shows us
utilizan en el
the kinds of
Internet
words
y
used
vemos
in
que
the
el
internet
séptimo es
to do searches,
nutrición.
and the
Pero si ustedes
seventh
se van al
is
detalle,
nutrition. But if you
no hay
go
una
to
sola
details,
búsqueda
there is not
asociada
one single
con sustitutos de leche materna o
search
con
related
lactancia
with
materna. Y esto me parece que
breastfeeding
es algo
or
muy cuestionable,
breastfeeding
muy
substitutes.
interesante
And I
poder
think that this
analizar,
is very
porque
interesting
tampoco lo hay
to
para
analyze because
alcohol y tampoco
we don't
lo
have
hay
it for
para
alcohol
tabaco.
and we don't have it for
Esto
tobacco
significa
either.
que tenemos a
This
alguien que
means
nos
that
está
we have
proveyendo información
someone
y no
that is
tenemos que
providing
salir a
information
buscarla.
and we don't
Ese es el
have
área
to
de
look
oportunidad que
for it.
nosotros vemos,
That is
en
the
donde
opportunity
tenemos
area
también
that
que
we see,
combatir aquello
and
que
we need
nosotros
to
no buscamos,
combat
aquello a lo
what
que
we can look
estamos
for,
siendo objeto, aquello que
what
va
we are
determinando nuestra vida. Todos
is going to
pensamos que una
determine
búsqueda
our
en el
life.
Internet es
We all think that
abierta. Eso no es cierto.
searches
Los
in the internet are
silogismos
open. That's not
o
true.
todos los algoritmos que
Syllogisms
se
or
utilizan en el
algorithms
Internet
used on the
para
internet
efectos de todo lo que yo voy buscando va determinando por anticipado qué es lo que yo
determine
puedo
in an
alcanzar del Internet. No
anticipated
es tan
manner
abierto como
what I can
pensamos.
find on
Y,
the
y
internet. It's not as
para cerrar
open
esta
as we
parte,
think.
solo quiero
And to
mostrarles que
close this
ese
part,
mismo estudio
I
nos
want to show
muestra
you that
que
the
en
same
cambio
study
hay 1031
shows that
dominios.
there's
Son palabras,
1,031
son dominios especializados
domains,
en
specialized
medicina
domains
alternativa y
in
cuidados
alternative
holísticos.
medicine
Esta
and
no
holistic
necesariamente es una
care.
práctica
This
clínica
is not
correcta,
necessarily a
pero de igual
correct
manera
clinical
tenemos
practice,
ese
but
gran reto
we
que
still
está
have that
vinculado
great
con
challenge
todo
related with
la explosión de información que
the
nos llega
explosion
a
of
través de la
information
Internet y que
that
está
comes through the
precisamente
internet and that is
direccionado a violentar
precisely
lo que el cuerpo necesita.
directed
Perdón
at
por decirlo de esta manera, los
um,
señores de la industria, pero
obstructing what the
es
code says.
cierto. Me
I'm
parece
sorry I have to
que
say
esta es
this
una
for the people
industria
in
que
the
está
industry, but I
convirtiéndose
believe
en
that
un
this is an
determinante
industry
comercial de la
that
salud
is
y ese
becoming
determinante comercial de la salud tiene que abordarse y
determinants
tiene
in
que
public
abordarse
health,
eficientemente
and
con
this
marcos
needs to be
regulatorios
tackled, and it needs legales to
que
be
se
tackled
vigilen, que
with
se inspeccionen, que se
regulatory frameworks that
fiscalicen.
are
Es
inspected
muy
and that
claro
are
que si
surveilled. It's
si
very
seguimos
clear.
alimentando
If we
a los bebés
continue
con
feeding babies
sucedáneos de la leche o con
with milk
productos que no
substitutes or
son
with
o no
products
vienen de la
that
lactancia
do not
materna
come
natural,
from a natural
seguiremos
breastfeeding, we
disminuyendo la
will
posibilidad de
continue
tener
decreasing
una
the
sociedad más
possibility of
justa,
having
más equitativa, más
a fair
equilibrada, que
society,
tenga
a
la
more
posibilidad
balanced
de bienestar
society, and
absoluto, que es el
creating
derecho a la salud y no solo
absolute well-being and the
no
right to
tener
health,
enfermedades o afecciones, es tener el
and not only
potencial
having
completo,
diseases or
la plenitud
affections.
para estar
We need to
satisfechos mental, física y
fight
socialmente.
for the
El tema de
plenitude and
salud
being
digital es un
satisfied
tema
physically,
que la
mentally, and
Organización
socially.
Panamericana promueve y está
Um,
promoviendo mucho en torno a los
Breastfeeding is
entornos
something
de
that is
atención médica,
promoted
pero también hay
in the
salud
healthcare
digital en la
environment,
parte de
but
la
it's
vigilancia
also
de la salud pública,
digital
en el
well-being
manejo de grandes datos.
and the management
Y
of great
para
data.
concluir,
And to
solamente quiero
conclude,
apuntar algunos
I
de los
would just like
retos.
to say
La
some of
información
the
ya la pudieron
challenges.
ustedes ver con
We have
gráficas
the
súper
information
interesantes,
with very interesting
con
graphs,
información que es muy
with
clara.
information
La
that's very
legislación
clear.
hoy de nuestros países
The legislation
no
today in our
implementa los
countries
mandatos del
does
código.
not
Esto
implement the
significa que tenemos que
code
seguir
mandates.
trabajando en
This
ese
means that we
camino
have to
para efecto de lograr
continue
ese
working
cumplimiento.
on that path
Nosotros vemos que
to
hay una
achieve that.
debilidad
We
en la
see that
vigilancia
there's
del cumplimiento
weakness
normativo, no
in
solo del código, es
surveilling
una debilidad general. La
um,
capacidad de
regulatory
regulación
compliance.
no está siendo
Regulation
actualizada. Estamos
capacities are
actualizando
not being
mucho
updated.
nuestra tecnología
We are
sanitaria, nuestra
updating our
tecnología de
health
salud,
technology. We're
nuestra
updating
tecnología de punta
our
para
our
poder
health
dar
technology or state
atención
of the
médica
art technology
oportuna,
to be able
para
to
curar la
provide
enfermedad,
medical
pero no
attention
estamos
to cure
invirtiendo
diseases, but we
en
are not
cambiar los
investing in
determinantes de
changing
salud.
the social
La falta
determinants
de
of
lactancia
health.
materna
The
es uno de
lack
los
of
principales determinantes sociales de la
breastfeeding is
salud
one of the
y
main
la capacidad de la autoridad
one of the
no
main social social determinants of health and the authorities' capacities are not being reviewed, harmonized, and strengthened. We believe that this regulation capacity, the authorities, a topic in which the health authorities should work together to break that legislative fragmentation that we have seen. We have seen that there are great violations in internet pages in terms of the information geared at the mothers, aimed at the mothers that have just had their babies, and it seeks to change that view of natural breastfeeding. How do we surveil that? The problem is that sometimes the ministries don't have the competence to do this. Sometimes it's in other authorities, in the ministries of economy, in the ministries of trade, in the ministries of telecommunications. These are those who do the surveillance. And then we have the intersectorial work between the different sectors. The other challenges that we see in this part is the weakness of regulatory authorities. There are less and less inspectors. There are less surveillance capacity because we lack money, but we should have more efficient methods to be able to do this surveillance. My country, as I was saying, was one of the few countries that had advertising surveillance. But this doesn't exist in many of the countries. There's no vision to promote health. And the other challenge that we see is transborder regulation. We have always believed that what is done in other countries cannot be controlled in mine, and that's completely false. Today, there are methods and there are legal obligations that several countries have included in Europe and Asia. In America, there are some countries that are regulating the internet in their borders, despite the fact that the origin of the information is beyond my borders. So there are formulas to regulate what is in the internet and comes into my country. And let's not say we cannot do this. We can do it, but we have to be intelligent. And we are also lacking the review of the regulatory frameworks to align this work so that we can all together think that health is one, health has to be in all policies, and that without health, we cannot have a healthy life. And so in this case, we wouldn't have human rights either. The last block, which is challenges, it is not clear yet if we can regulate the internet. Of course we can. Lawyers find the formulas. You just have to tell us what you need and we will do it. I think that we have to call the ministries of health so that their sanitary regulation areas work with their legal areas, with their national congresses to build a real regulation of the internet for internet topics or matters, and especially for everything that has to do with digital marketing of milk substitutes. And the other big question is, can we regulate artificial intelligence? There are two great blocks. Europe recently, last year, approved the first strong regulation on artificial intelligence, and the topics related with the health are the most restricted ones in Europe. So the question is, why are we so slow in America? Can we regulate artificial intelligence? Can we regulate the information that is, or data that is fed to artificial intelligence? Because this is an important topic. Parents should only be focused on children's well-being, and so comply with the code, surveil the code application is part of our mandates as human beings. Thank you.
Thank you very much, Dr. Ignacio Ibarra, for your presentation on the legal tools needed for updating the national laws for the digital era. We are going to move now toward final presentation and that is by Dr. Lawrence Grommerstron. Dr. Grommerstron is the head of the Nutrition and Food Safety Action Unit of the World Health Organization. And he'll be telling us about some tools to track digital marketing of breast milk substitutes. Over to you.
Thank you, Audrey. Good afternoon, everyone. I'm happy to be joining you to be talking about what some of the tools are that we can do for monitoring purposes. In the presentations we've had so far, we've heard a lot of talk about the legislation that's needed, why we need to do greater advocacy on that, and some of the progress that we've seen in countries. And we have seen progress around the world, as reported in our recently released COVID status report. But what we often hear from countries is that while they get in place the legislation, it's very hard for them to monitor and enforce that legislation. We see significant gaps, that there's a lot of laws on the books, and yet we still find lots of violations. The companies are not adhering to this. And so it's critical we really think about the tools for addressing it. We have a lot of challenges when it comes to the space of digital marketing, in that it can be much more complicated in some ways because it transports across multiple platforms, different modes, new strategies that are being used for marketing that were just never even considered 45 years ago when the code was first adopted. Just new ways that this is being done. It's ubiquitous. It appears and it disappears. It can pop on your cell phone. You see the ad for 2 seconds and then it's gone. So how do you actually capture that information from a regulatory standpoint and hold people accountable for it? At the same time, while it is difficult, it also is easier. Because what we used to have was different channels that we would see this, and we had to send someone out to look at the labels that were in the grocery stores, where the formula is. We'd have to be looking at the billboards that are there and looking at the magazines and newspapers and listening to the radio to capture this information. We now have tools that we can actually do this at a desktop. A person can be sitting in an office and use these kinds of tools to actually conglomerate in one place. Here's what's going on with the marketing. Let's hold the companies accountable for what they're doing from the start. So it's a critically important issue for us to address. In my talk, I have no conflicts of interest to declare today. To set a context, just before us at the beginning, we have from the resolution that was passed last year by the World Health Assembly, exactly a year ago, because we're in the World Health Assembly going on right now. Resolution 78.18 that was put forward by Brazil with support of Mexico. And one of the key parameters within that, the operational things that this called upon, was that member states need to build and strengthen monitoring systems and technologies to address this problem, particularly in the digital environments. And the guidance that WHO produced on this recommended a number of different strategies that should be explored in this. Public mechanisms for reporting violations, digital technologies to detect those violations, giving some specific examples in social media, intelligence platforms, screen captures, ways to analyze the traffic that's going on the internet, artificial intelligence to really analyze this information. As we talked about that in the guidance. And they also talked about some of the legal provisions that can be put in place to make our job in monitoring a little bit easier. So I'm going to talk about some of the key examples of tools that we've created or have seen. I'm sure this is not everything that exists out there in this huge world of ours, but I think that they might be some tools that would be of interest to countries as they're trying to address how to monitor this. So I'm going to talk about 6 of them today. The first one is an old tool, wasn't created specifically for the purposes of digital, but I think it's quite appropriate in this context. It is the Netcode protocol for ongoing monitoring systems that simply looks at a simple way for those who are living in the world to capture what they're seeing in the world. And those might be people who are charged with this, the food regulators who are supposed to be making sure that we're following the laws of our countries. But it can also be health professionals who care specifically about breastfeeding and how do we support that. They might be lactation consultants or peer counselors who care about this and say, look, here's what I saw. Here's what my patients are seeing. Here's what my family is seeing. And reporting those back to the government that is responsible for the enforcement of the laws and provide that information to them. It can come from the general public. And so we created in this Netcode ongoing monitoring system universal tools that just capture the information. It's an online form, could also be a paper form, but in this context, I think it's easier to think about the online format to simply take a picture and submit that in this, and those will be picked up by the enforcing officials. It's extremely easy. Oftentimes when we're talking about this digital, it gets scary to people. It's artificial intelligence, it's targeting, it's a lot of very complicated terms that people are talking about. But in this context, we have a very simple one-page data entry form to provide that information. So anyone who wants to provide that information can just fill in a few key pieces of information, attach a photo or a video that provides the evidence of what they're seeing, and sends that directly to the officials. That comes right to their desktop at the Ministry of Health or the Food and Drug authorities that are responsible for enforcement. And setting this up is extremely easy. There's a data entry program that WHO has made available to anyone. You can just download it off of our website. And I'm going to show you the entire program. It's an Excel sheet that has about 6 different columns in it. I don't expect you to read this because you don't need to read the code, but there's nothing more to it. This is something that can easily be put into standard software that is available for free of charge to people, and you just give it this code, and it creates that form. Anyone that has access to the internet can provide that information and provide it directly back to those who are controlling this, presumably at the Food and Drug authorities. So it's a very simple system. A second, also put out by Netcode, is the protocol for periodic assessments. That isn't about the ongoing, just capturing violations as they occur. It's more of a research format. It's a matter of how do we actually assess what's going on. And what was presented today in some of the early presentations are the kinds of examples. I know they didn't come specifically from Netcode, but they were activities taken on by some entity, in this case, Ministry of Health, maybe a university, an academic setting, that tries to say, well, what do we see is going on so that they can document the story. Within that, there's a mother's survey that goes out and asks mothers as they're appearing in the health clinics about a wide variety of ways in which they're seeing ads, being exposed to ads, exposed to these promotions, including what they're seeing on the social media, on the internet, what they're exposed to in terms of being invited to go to online social groups. Are they participating in those social groups? Online events that they might have seen about that are ways that are drawing them in to this kind of advertising. And so as part of the study, we get mothers reporting what they're seeing. There's also a separate module within it specifically about what we can find on the media. And so just intentionally going out and canvassing what do we see on the Facebook pages of these companies, their websites, Twitter accounts, YouTube channels, Instagram, et cetera, of the manufacturers, looking at online mothers magazines, formats that we might expect that mothers very frequently would be turning to, online retailers, what they might be seeing on places like Amazon and other sales that they can see the ads and retail calls for, if you buy one, get one free, you get this, and you get other free products along with it. And just use this in a very intentional way to say, well, what's out there? It's not being passive of what's being hit to us, as you might see in the ongoing that I talked about in a minute ago, but it's what can we find and document that because those are violations and they can be directly acted upon. So these very, very old tools, really now, they've been out for about a decade for use, but they certainly are applicable in this digital space. As we move forward thinking more about what's going on in digital, one of the things that WHO did was we commissioned an analysis of what's going on in social media. So instead of going directly to the sites and just saying, well, what do we see in Facebook? Actually did some monitoring by tracking over time what's happening over this. And so tracked over a course of 3 months what was happening across 17 different countries, 11 different languages, and we identified and aggregated the conversations that we were seeing in social media, on websites, on various forums online, and did that by tracking various keywords and phrases. The ones things about the phrases about infant feeding might be about breastfeeding or formula feeding or how do I feed my baby, trying to capture the key words there. The different products that we'd be looking for, breast milk substitutes, also looking at bottles and teats and complementary foods can be part of this. and various messages that we knew we'd been seeing ourselves in this. Were we seeing those kinds of messages in social media? A lot of work went into this development because we had to understand it in multiple languages, different countries. What are the kinds of strategies that they're seeing there? What are the products that they're seeing? Because we needed to see it by the brands that are going out. So what brands are being used in those countries? Um, Unfortunately, we were not able to do this in videos because it was a keyword. It was much more intensive to see what kinds of words are being used in video, taking the images and turning them into actual words that could matched up there from an image character recognition. I think the tools for doing that are much greater now than they were at the time. Um, Unfortunately, we weren't able to get at dark posts and private groups. But we were able to do a deeper analysis and really understanding what's going on in the messages around these. So were they positive messages or negative messages? Because when you do these kinds of keyword searches, you're also going to pick up things from breastfeeding. They're going to pick up things from civil society, from the ministries of health that are putting out their messages, NGOs, healthcare providers who are speaking about breastfeeding and infant feeding. So we wanted to see, well, which ones are positive, which ones are negative? How are they looking there? What kinds of messages are we there? Who's putting them out? Is it an influencer who is talking about this? So we could really analyze what's going on. And this was what was used to drive WHO's report on the scope and impact of digital marketing strategies. That was then the basis for why we needed to have the resolution. So it was a series of steps kind of building the case for why we had to address this and really understanding that case. While we did it from a research mode at WHO, what we learned is that these are tools that are available to anyone. There typically are companies that do this. They call themselves social media listening platforms. And so ministries of health can contract with them to say, look, we'd like a similar kind of analysis to be done for our country. It doesn't have to be as big as the WHO one, but it's only for our products in our country. We want to focus on particular sources that this is coming from and have them collect that data over time, analyze it, and report it back so that they can use it for enforcement purposes. Another format has been promoted in the European office of WHO. They call it CLIck. I won't go into what CLIck stands for. It's a kind of complicated set of words behind CLIck, but that's just what the tool is called. And it's using screen captures on cell phones. So it's only a particular aspect of what's going on in digital marketing. But the nice thing about this is that it actually does capture what people are actually being exposed to. And so they recruit mothers in this particular case. They also use it with children for different kinds of marketing. But in the context of breast milk substitutes and foods for infants and young children, they recruit pregnant mothers and recent mothers within the last with children under the age of 2 years. And they've tried this out in Portugal, the UK, Armenia, Turkey, to capture what's going on those mothers' cell phones. What are they actually being exposed to in terms of the marketing? And it automatically captures screenshots. It's an extra app that's added on there. And so as you're going through your Facebook page, maybe, or you're having conversations with people, you can actually capture what these women are actually seeing. And that captures what's actually intended to be an ad. So it might be a pop-up ad that shows up when they're looking at the internet. It might be something when they're going through their Facebook feed and they're scrolling through that they see these things coming across the screen. An ad appears there as part of their screen. But it can also be an email that they received from the companies or a text message that says, well, also get information and get in touch with us about this. And so it's able to capture that information. It creates a massive amount of data, but an analysis of the images that comes through on that is able to detect, well, which ones of these are actually ads as opposed to just the routine information that these mothers are getting exposed to, screen that out. So we're really only pulling the advertising information, and then use artificial intelligence to analyze that to really understand what was the text of the message that they were getting, labeling these specific screenshots that are considered to be advertising, and describe the content so that it can then be described back to the enforcers. Here's what these mothers are actually being exposed to. And so it gets much more in depth at understanding what is actually happening to the recipients of that. It has been tested in many countries, these 4 countries, and as a software that is available for others to use. The next tool was already presented in one of the previous presenters. Is called Vivid to use to get virtual violations detector to really detect the violations to the code. And this was really the first use where AI was used to monitor code regulations specifically. It was developed by Live and Thrive, an NGO, in its work in Vietnam originally. And what they set out to do was really train an artificial intelligence model to really understand the code, essentially, if you can expect computers to understand things, but to apply the code provisions as well as the provisions in the specific country, that differentiation when there are distinctions between national legislation and the code, and to convert those into algorithms that you can take an image or a message that is provided to the computer and understand that in terms of this is a violation of code Article 5.1, or this is a violation of WHO Resolution 69.9, Recommendation 5. So really tease it apart in terms of really understanding what are we holding people accountable for so that we can provide appropriate legal sanctions against those. Um, to train that, they pulled together examples of product images and text that they could find themselves on the web, provide that into the software, listing of the key words that it ought to be looking for in the language of the country, and compile that across web pages to actually detect these violations across the web pages. They had to provide multiple examples of the violations to show, okay, this is what we mean by a violation of this particular article, to teach the artificial intelligence how to work it. And then iterate this multiple times with the expert saying, no, you've actually called something a violation that's not a violation, or, oh, you've missed a violation over here. Why didn't it pick that up? And keep teaching that artificial intelligence to do it better. Um, the key focus of this was to classify the violations. Now that they have it, it can also do that scanning of the web, and that is part of what it does in the follow-on countries what it's doing. But its primary focus was really to do that understanding of the violations to make the job easier for the enforcer so that they're not just bombarded with, all right, here's a list of all of the possible violations that might be a problem for us. They get 1,000 screenshots and say, well, what am I supposed to do with this? How do I actually take action? They really wanted to push this into an understanding of what exactly is in the law or in the code that they need to be taking actions on. This was developed in Vietnam. It has now been rolled out in a similar model using the language and particular context for Mexico and Argentina. It is now in operations in Laos and Mongolia, not yet live, but they're working with them to develop it in the national language in conjunction with UNICEF and the ministries of health in those countries. So it's another model that is carrying forward. And the sixth and last of these that I wanted to mention is a new one that's being developed in Brazil at the Fiocruz Institute, called Digicode. It's an AI platform developed in a similar way, really, to Vivid was. And they have not yet taken it to other countries, but they really are ready for multi-country rollout. It similarly scans public ads and relevant public pages. It's not getting into those dark ads that just might appear but are not publicly accessible. And it reads the brands, product key terms, promotion messages, similar to what Vivid does on a continuous basis. And it's really set up to be an ongoing process, to be open to the internet as new things come up, that is constantly capturing these as they're coming in. It does require a human review to validate the violations. It does classify them in the same way that Vivid did. But really, in order to turn that into a legal enforcement, they do recognize that you're going to have to go through and check, yes, do I actually agree that the image that I'm seeing is indeed a violation of the law in my country before you can take action on it. But where this one goes to the next step is it really creates a lot more summary tools. Whereas Vivid provides you a list of here are the potential violations and how we would categorize them. What this one does, it really tries to summarize that because it recognizes, look, there may be hundreds, maybe thousands of violations that become very complicated for an enforcer to act on. And this is able to bring them into, all right, here are the ones that are ads. Here's the ones that are promoting through healthcare providers. Here are the ones that are violations of what's on the label. So it makes the job a lot easier for the enforcer. Brings that information into spreadsheets, dashboards that you can track over time. Some more tools on the analysis side, but not quite as much on the actually classifying into the specific code articles within that. So it's kind of ready for broad use. They're in a lot of discussions within Brazil about use in the government there, but it's kind of a new tool for us to consider. So I want to just kind of summarize across these what I think are some of the pros and cons of these different systems. This is my own subjective assessment of them. But in terms of costs, I think those first two in netcode don't take a whole lot to set these up. The netcode ongoing protocol, as I showed you, the software's already there. You can put it in and basically put it on your website. Hey, tell us about these violations. Very little that's needed up front on that. A little more for a periodic study with Netcode, but the tools are all already available for you there. Social media listening, I think, is a lot more high cost. It's a more intensive way of scanning across the internet, and a lot of work with external people to establish exactly what they're supposed to be looking for. So I think that would be a high cost method, but it is more in depth. Click is probably somewhere in between. I think Vivid and Digicode are higher cost, but because they've already developed the basic infrastructure for that and already have the code built into them, it's really just a matter of how do you actually tailor that to your own country, to your own language, to the brands that are being used in your country. So there's some training it for the local context, but not so much for the code and how to understand this. So not nearly as difficult as something like social media listening might be. Are they systematic? I say that the ongoing protocol and the click are not really systematic because you're relying on human beings to provide more information to you. In the case of click, to agree to, yes, I'll let you see what's going on across my cell phone and feed it off in certain ways. Only certain people are going to be willing to do that. Whereas the other tools are actually scanning what's going on the internet. And so you can really say systematically, we picked up all the violations of a particular kind as long as they met a particular set of criteria. And so from an enforcement standpoint, it might be easier to say, we can enforce these because we know exactly where they're coming from. We're capturing all of them. There is no biases here that we're favoring one company versus another company or against one company. In our enforcement mechanisms. So there's some real strengths to those that are much more systematic. Which ones scan the digital media automatically? All of those automated tools on the right will automatically be capturing that for you, whereas the netcode does require more human intervention to go in and say, all right, what do we actually see is going on here and analyze that. Do they capture what is not publicly available that just anyone at their desktop can pull up and see the ad just by knowing what the URL is or going to the Facebook page? Yes, the netcode ongoing protocol and click do that because they're relying on individuals who are actually seeing this at their level, on their own cell phones, in their own emails and such. They can capture that and say, here's what I saw. Maybe it wasn't accessible to you, but it was accessible to me. Clearly, the companies are doing this, whereas some of the other systems don't really do that. An interesting caveat there about Digicode that we're still trying to understand deeper, but it turns out that for the most part, even these dark ads that are only appearing on some people's websites and aren't accessible to us just as at our fingertips when we do internet searches and such, there are laws in the EU that require the companies, as part of the EU's regulations around digital services of companies, essentially, that they have to declare every ad that they pay for. And even if it's only directed towards some specific individuals, or not individuals, but certain characteristics. So they may say, look, this ad is only for women who are identified as being in their third trimester of pregnancy, that reside in the northeastern part of Brazil, and have expressed an interest in why they're not producing enough milk on their previous baby. Something as narrowly defined as that. Or even characteristics about the mothers themselves, women who are in their 30s. that they can tailor that ad to a very subset of women, but that has to be declared under EU law as part of this large database. And what they found in Digicode is that they can actually access that database and find out what is being used going forward there. So it's an alternative way of getting at some of these very private targeted posts. Um, in general, the software does not automatically analyze whether or not this is a violation of the code or national law, but Vivid and Digicode do that. So those easier sources over on the left side do require more human intervention as you're seeing things coming in, whereas Vivid and Digicode do that more automatically. And then do you get those automated reports? As I said at the end, Digicode is really the only one who automatically summarizes that for you. But it's still being rolled out, still being tested for actual use. A little bit more, it seems to be a little bit more cutting edge with more capabilities to it, but it is, hasn't been quite as well tested. On my final slide, I just wanted to mention that there are other strategies that can be considered. It's not so much digital tools in the ways that the things I've been talking about, but some of the things that we did talk about in the guidance was that in writing the laws about the code, you can have laws that require your advertisers to publicly disclose what they're doing advertising for, including their targeted advertisements, along the lines of what I was just talking about for the EU. But in your own countries, you can say, look, if Facebook is going to operate in our country, you have to share with us data on the ads that you are selling. What are you selling ads for? And you can then scan that with a quick search across it, what companies are doing, what are those ads that they have there, and hold them accountable. Well, that's not allowed in our country. You can't do that, and you don't have to do separate monitoring for it. You can make it the law that they have to report that to you. Internet service providers it can be required to also monitor. So not the company who's doing the ad, but the ones who are carrying the ads for them, who are receiving the funding to host it on their sites. They can be required to report, well, what are you doing to monitor the content of the ads that you're getting to make sure that you're not participating in the violation of the law. They can be required to report the actions that they're doing to block those. So they need to build systems to make sure that prohibited marketing does not come through, just as they would be doing that for pornography, just as they would be doing that for violations of violence. Someone who wants to come on and push, oh, I'm just selling a gun here. Well, they have systems to protect that they're not allowed to do that. Those kinds of laws can be put in place. Look, you also have to share this information with us on how you're blocking that kind of content. And then finally, you can have laws in which civil society organizations or even individuals can be officially designated to have the right to bring complaints before the courts. So rather than having to report that to a legal department within the Food and Drug authorities, who then have the enforcement strategies under their auspices, and maybe the bureaucracies, the competing priorities for them that they just can't take this on. Sometimes that's difficult to actually get it through all the bureaucracy of the government. If the law says that the civil society organizations can take that directly to the courts, it is an alternative strategy for enforcement that this goes immediately to. There are enough cases here that we actually have to see this within the courts. So additional strategies for you to approach for the monitoring and enforcement strategies. I want to thank you very much for your attention. And like the other speakers have spoken, I would welcome any conversations we might be able to have today. Thank you.
Thank you so very much, Dr. Graham-Strone from WHO. I'm afraid we are running very late, but I think we can have one or two questions. And in fact, there's one that I would like to address to you. Someone has asked in the Q&A, what substantial factors do you believe have contributed to non-compliance with the code for so many years?
That's a question for me. I think that's a question for all of the speakers today.
Okay.
I think everyone has spoken about the non-compliance that is there. Well, I guess I would just come down to the simplest reason for non-compliance is that these companies are making billions of dollars off of this. It is a $50 billion industry. And if you don't have in place legal sanctions to hold them accountable, that they will see it as in their financial interest to not break the law and violate the code, they have every incentive that we'll just continue doing what we've been doing because it rakes in more and more dollars for us. It also gives them greater power in the multiple structures in legal frameworks where they're lobbying, in the World Health Assembly when they can exert their pressure, in codex conversations in the World Trade Organization, because they have billions of dollars at their disposal. It's easy for them to exert that kind of pressure, and it's easier for them to invest more and more in the marketing itself. Simple answer.
Quite simple, I agree. Okay, thanks for that. And we have another question. And this has to do with sanctioning. So someone has asked, could healthcare professionals, and this is for any member of the panel, could healthcare professionals who promote infant formula on social media, as well as influencers who promote it, be sanctioned or have their right to practice revoked? Strong question. Any takers for that one?
I was actually going to point to Ignacio, but in the interim, I might jump in there and say, absolutely, you can. We have countries where there are examples of where there are sanctions against healthcare providers. They're usually fairly small sanctions. Um, there's been some reticence, I would say, to enforce them very strongly because there's obviously pushback from the healthcare providers and say, "Oh, but I didn't know this, and how was I supposed to be responsible for this? The company did it, and such." And healthcare professionals have the ear of the Ministry of Health, and so there's a very close relationship there. So it has been difficult to enforce, but it certainly can be done. One of the things that we've actually encouraged countries to do is to put in place very mild sanctions. You might say that's, if it's mild, why would they pay attention to it? But I think it would actually get greater enforcement, that there's more willingness to apply a small sanction on a healthcare provider. And I think that the word would get out. In the specific example, it was actually participating in conferences that are sponsored by industry, that this shouldn't be allowed. And healthcare providers was, well, what am I supposed to do? Well, if you gave someone just a $25 fine or a $50 fine, it's not going to be a lot of money to them, and yet they're going to tell the other people that they work with, "Hey, I was just fined for going to this conference. What's up with this? This is the problem. We shouldn't be doing this. Oh my gosh, maybe you're going to get fined as well." And would make everyone have second thoughts about how they work with industry. Those can be ratcheted up over time. If they do it multiple times, you can have graduated sanctions and such. But definitely the possibility is there. And I think that we ought to be looking more toward that.
Thank you. Monica, you wanted to add to that?
Sí, gracias. Muy rápidamente y creo que
Yes, thank you. Very quickly, and I think this is also related to the previous question. We are trying to help and understand what the interest conflict means. And I think this is basically related to the fact that we basically don't understand quite well what the conflict of interest means. And we were having focus group with health professionals and other key stakeholders, and we found out that they do not know they are implementing bad practices. We were having advocacy, digital education through social media to raise awareness about the meaning of conflict of interest and how to avoid it. Thank you.
Okay, thanks for that. Unfortunately, we are a bit over time and we will not have time for any more questions. Our panelists have done a good job of answering some of the questions in the Q&A, and we will try to follow up if there are any, that we can follow up with afterwards. So for now, I would like to ask Dr. Garcia Larson to do the closing remarks for us.
Thank you, Audrey. Well, just to thank you all so much for joining us this morning. Thank you to our very distinguished speakers, Marina Rea, Monica Mazariegos, our very own Ignacio Barra and Lawrence Grammer-Strong for the time to address such an important issue. We've seen how many comments you put here in the chat. We're going to look at them, and we very much appreciate the interest that this topic is gathering. So we very much look forward to continuing this dialogue and to disseminating the tools that were discussed today. I think we can all benefit from trying to address the digital challenges that we are all facing when it comes to securing breastfeeding, which is an issue for parents and babies alike. So let us work together to build a transparent online environment where clearly we can address the well-being and health of the future generations. So thank you all so much, and I look forward to continuing this important discussion with you all. Thank you. Goodbye.
Thank you. Thanks to all.